Good morning everybody, my name is Jesper Lakman. I'm the project manager of this project Applied Health. Unfortunately I'm not able to be here today because besides working at the Odense University Hospital, I'm studying a master education in leadership and innovation, and they have messed up the dates after we have planned this event, so I had to be there today, unfortunately. So the Interact 4A program is a program between the two regions from Germany and Denmark, Region Syddanmark and Slesvig-Holstein-Kern. We have 4 partners in the project. We have 2 on the German side, which is the University Hospital in Kiel and Fachhochschule in Kiel. On the Danish side we have the same setup. We have Erhvervsakademi Lillebælt, EAL, and Odense University Hospital. The point of this project is to make mock-ups with the students. In Denmark we have 5 student groups making mock-ups and proof of concept at 5 different challenges from the clinical domain, and they're doing the same on the German side, and you will see that later in the presentations. So this is the third Interact project that we are running between the German partners and Danish partners. The reason why we do these projects is kind of a platform to investigate or look into different technologies. At this project we are looking into apps, trying to figure out what kind of apps to do at the healthcare sector. At Project Robin we were looking into robotics, and at Health Games we were looking into serious games. So we use these projects as a platform because we cannot have partners from the industry. It can only be public partners, therefore it's more like a platform. So why is apps or applications for smartphones interesting for the healthcare sector? Well, first of all, we can make applications that make a better flow in the clinical departments. Like one of the apps I'm going to talk about a bit later. We can use applications as part of the treatment. We can use it as a communication tool. We can use it as an information tool. Within a couple of years, all clinicians, they have a smartphone, and most patients already have a smartphone, and before we know it, everybody will have a smartphone in our society. Therefore it's easy to communicate, it's easy to send information. We can use it to book appointments at the hospitals. We can use it to send information about their treatment. We can make apps where we put in gamifications, put in motivations for the patients so they can do the rehabilitations. We can actually put in social media, so the patients, they can communicate together when they're not at the hospital, when they're back in their own homes. We can also use it as a prevention tool. So working with applications gives us an array of different possibilities, and the way the financial and economies are at the hospital at the moment is we're going to have less money to do the same in the future. Therefore applications is a really strong technology to work with. Working with technologies like smartphones and tablets, this is technologies that you can buy in the supermarket. They're fairly inexpensive and everybody more or less have one. Therefore when we do development projects, we don't have to make a robot from the beginning, we don't have to make an expensive engine. Making the apps, making it available on App Store or our internal App Store or on the Windows platform, it's fairly easy for clinicians and for patients just to go and download it. So besides Applied Health, we have another huge project about applications and serious games, and that's called Game Lab for Health. Basically what we are going to do is, in the middle of the clinical departments, we will have a lab, and we have 20 partners. They're all financial partners in this project. And what we will do is we will do mock-ups with the students, and we will do real prototypes with the industry. We have some of the leading companies in this region developing serious games and apps. And besides that, we are supported by Microsoft, by Apple and by Samsung, who all find this project really interesting. So in Game Lab for Health, we have on one side we have the industry, some really skilled partners who can do applications for smartphones, and we have someone who can do applications for serious games. On the other side we have the clinicians in the hospital. In between we have an array of different partners, both public and private, Among them we have the university, we have Erhvervsakademi Lillebælt, we have other partners who can bring in students so we can do mock-ups. But besides mock-ups, we're doing real prototyping for implementation, and we have an array of prototypes. The first application we will do in GameLab for Health is an application for acute cesarean. Today we have difficulties following the Danish standards, not just at this hospital but everywhere in Denmark. At the sector 1 the child has to be out within 15 minutes, at sector 2 the child has to be out without 30 minutes. Today what's happening is the doctor is calling 7-8 different people to get the surgery team ready, and that takes minutes. So what we do, we make an application, and when you pick up the phone and you swipe, they can see at the ward, at the surgery ward, that they're coming. So instead of using 3 or 4 minutes to make the phone calls, we can do this maybe in 10 seconds. So that's the first application we will do. The second application that we do in GameLab for Health is for COPD patients. What we hear from the patients is in between training, in between the rehabilitation at the hospital, they need something. They need something that can motivate them. So what we will do is we will make an application they can bring home on a smartphone, and they can do the exercise. They will count the exercise. There's going to be elements in there for motivation. We're going to put in gamification. Besides the exercise, which there are tons of applications talking about exercise, we will do social media so that there can be an interaction between all the patients in the different groups. So you can either see patients, you can see the other patients doing their training, and that will motivate you to do the training, or you can have a chat between the different patients. We are just working on the application at the moment, but we think that if you do an application for COPD patients, this application could be used for heart patients. It could be used for all kinds of chronic diseases like diabetes or cancer, exoskeleton. So we think there's a huge potential with this application. The third application we will do in GameLab is all these treatments that we do at the hospital. Every time we have a specific treatment, we have a folder. We have a printed folder that we give out to the patients. And for the chronic patients, they are in and out between different departments. They get lots of these folders all the time. So what we're doing is we're going to take all the folders from the university hospital, we're going to put them down in one application. And to make it easy, if we have patients traveling from one department to another, we can go in with a back end and we can choose what kind of applications that the patients should have. So we can always optimize what kind of applications there should be available. So instead of looking at maybe 200 or 300 different brochures, we can just go in and point out which one at this particular time is important for them. We can also, instead of having the printed versions, we can do videos. We could do links to readings and stuff like that. Besides doing all these prototypes in the projects, what we are doing, every 3 weeks we have an event where we take up gamifications, we take up how can we get these applications approved, we can take up what kind of clinical challenge do we have, how can the companies put this on the international scene. So every 3 weeks we look into a different theme for both the clinicians, but also for us as project managers, but also for the industry, to get a knowledge, and together we create this new knowledge about how to work with applications in the healthcare sector. And I think that's a really strong opportunity for everybody who participates in the project. Besides the project partners, someone who is not a partner can also participate. In applied health, we're basically doing 2 things on the Danish side. We have the 5 student projects where they're going to come and present it today. Besides the 5 student projects, we are doing 2 professional applications. One is the Wayfinder app that we do together with work. Basically, we have lots of patients who are late for their treatment. They can't find a way around. The Odense University Hospital is a huge area. So providing them with a Wayfinder app, we are able to give them a tool to come to the interest in version 1.0. In version 2.0, we will actually guide them all the way to the clinical department. The second application we do with the industry, we do together with Ad Factory. Basically what we do an application for the neurological department. They have lots of patients with brain damage, and for them it's very difficult to understand the verbal communication. So they are basically asking for a tool where they can show pictures, they can show animations, and they can show movies. And today they're using a lot of time Googling on the internet, trying to find the right pictures, trying to find the right movies. So we're basically doing a library application where with 2 clicks they get to the proper picture, the proper animation, or the proper video. This application, if you can use it at the one department, we have other departments that have the same need. They have patients with special needs. We have patients in the children's ward who it's difficult for them to understand all the verbal communication. It's easy for them to understand through pictures and through movies and through animations. So basically we're making a platform that different departments they can use. Besides all the pilots that we're working on at the moment, we have, with this technology, we have lots of things in the pipeline. We actually, for the first time, being contacted by the clinical departments because they want us to do these applications. So we have lots of things in the pipeline, and that's really good for the industry. They can be here and they can pick up. We can kind of look into what we have in pipeline, and they can see what is the application with the most potential, and we can start working on it. So I think there's a huge opportunity for us to actually create a new industry working with mHealth and healthcare applications. And it could be wonderful if for the first time that Odense could have this first mover. Maybe Odense could be the place they're looking to making these applications. So with these words, I would like to say welcome to this kickoff event in Applied Health. And once again, I apologize for not being here today. I'll definitely be here for the next event, and I hope you're going to have a wonderful afternoon. And I'm very excited to see what the students on both sides of the borders has done. So thank you very much.